Welcome back, dear students. We are discussing about prescriptions and medication orders. Up till now, we have covered what is those prescription and medication order, what is difference between those both. Then we have seen what is the interpretation, how the interpretation can be done, why the pharmacist should read properly the medication order or the prescription, because of the medications which are dispensed are according to uh, decisions which are made clear in the prescription order, which are written that is by the prescriber, and it is the responsibility of the pharmacist to evaluate the correctness, okay, that we have seen. Then we are discussing about the PRN, that it is one of the important aspect in the medication order, which is mentioning when to take the medicine or medication depending upon the sign and symptoms that we have seen. Okay, then there is a specific protocol which is called as PRN protocol, which gives the pharmacist as well as the patient a, a exact direction for the administration of the medication as and when needed. Okay, then that protocol uh, should be properly understood and should have the inclusion of details: what quantity of medication, the duration, the frequency, everything should be properly noted down in that. Okay, then it is also having the mentioning when to call a doctor, or that is prescriber, physician, or the nurse, when is the condition they should be contact. Okay, if any sign symptom are found into the uh, patients. So this thing we have discussed yesterday. Then in last lecture also we have gone through some important questions which should be born into the mind of the pharmacist before giving the or fulfilling the prescription, okay, or dispensing the medication. What is the name of medication, what is the purpose of medication, what are the effects of the medication on the patient. Then another question: how long it will take the medication to work, okay, the time duration which is needed to uh, and get the complete 100% cure, what it is called as. Then which are different problems associated with the administration of that medication, that is side effects, adverse reactions if were taken, okay, those sign symptoms along with all the blood parameters which are possibly observed after the administration of medication should be indicated in the medication order, or it should be known to the pharmacist. Another thing, uh, is there any possibilities of interaction of the medication, that is there are many problems which are generally associated with it, okay, that also should be known. Then if any medication out of the order which is needing some special uh, direction for their use, like when to administer, okay, for example we also discussed it, okay, during meal, before meal, with water, with milk, likewise. And if any specific storage conditions are needed to be uh, maintained for keeping it in active form or retaining the potency of medication, they should be followed properly. So these are generally written in the medication order, and these are as per the protocol, which is called as PRN protocol. So what we can understand that the pharmacist must get these all detailed information. Okay, definitely uh, when the pharmacist is having such knowledge, that pharmacist is able to forward the same to the patient who are actual user of the medication or of the medicines, and the knowledge can be acquired from prescriber, okay, or pharmacist by the patients. Then keep the information in the medication log so as you can review it frequently. Medication log means you have to maintain a specific record of the medication order or the prescription with you. Okay, nowadays there is a software available at every pharmacy. Okay, in that software they are giving you the uh, printed format. If they are having printed format of medication, they are prescription they are giving, okay, the bill which is generated, and in that they are um, maintaining the details. Okay, they are they can be, that details can be used as and when needed. Okay, now next thing, to interpret the prescription or medication order, there are several abbreviations mentioned over it, okay, which are written by the prescribing doctor or physician. Okay, so we are having some 164 such abbreviations. Okay, some of these you might have already studied in pharmaceutics, I think. Here we have to go through all of those. We should be aware with such abbreviations and what are the meaning or definition of those abbreviations. Several are the in abbreviated in the form of the what it is called as a Latin terminologies. Okay, so I have put those abbreviations in a tabular format. We should know at least uh, these. Okay, let us go through one after another. Many of these might be known to you. See, first AA in small, that is affected area. Then AC means A dot C dot small before meals. ABW actual body weight. See, there are uh, very specific terminologies or abbreviations were made. Okay, we should listen them and remind them properly. Okay, if you will be working further in future as a pharmacist, okay, either in India or in out overseas or in other countries, you will be having the help of such terminologies. So better learn now. AD, it is up to, if in continuation without full stop in between A and D. Okay, and in this case A dot D dot, which is in right ear. Okay, we know generally if ear drops are there, they are put in right ear or left ear. See here, as both are associated, AS, this is the last at the bottom. Okay, it is the left ear, and AD is the right ear. Then AM, this is known to us. Okay, AM morning. Okay, similarly PM, that is the afternoon or at the night. Okay, PM, those are there. Then ampoule, AMP for ampoule. Then capital APAP is acetaminophen, that is the drug, and its shortcut is used. Yeah, another one, this is very popular and known to us, is AQ, aqueous means water. Okay, BW, body weight. See here, ABW, actual body weight, and this is the body weight. Then C, which is also known to us, centigrade. This is another popular terminology, actually width. Okay, how we used to write C, or a line over C, okay, which is written like this, C and a line over it, that is width. Then another common terminology, capsule, CAP. CC, this is also used, cubic centimeter. CR or CRM, it is used for cream. D for day. Okay, then DISC, disk. Okay, or D dot C dot, or D oblique C, that is the having meaning discontinue. Okay, several time it is needed to mention in the prescription or medication order when to stop the medication, XYZ medication or medicine in the list. From that, which should be discontinued if any sign symptom arises. So at that time the doctor used to write this shortcut over there. Okay, then DISP means dispense. Okay, DIV, that is divide. Okay, then some other uh, this what are called as abbreviations which are popularly used. ASA, aspirin. Okay, shortcut for aspirin. ATC, around the clock. AU, that is each year. See, in earlier table what we have seen, AD right ear, AS left ear. Here AU means in both year, for each year. See, another uh, regularly used terminologies, BID. Okay, basin die, or twice a day. BIW, again twice a week. Okay, important thing. BIM, this is also several time used, body mass index. Body surface area, BSA. Then again very popular, date of birth, DOB. Then DS, double strength. D T and D dot T dot D, again give as such doses. Another popularly used abbreviation, distill water, DW capital. Okay, generally we use this terminology DNS. Okay, but actually it is D5NS. This is dextrose 5% in normal saline. Doctor, if anyone of you might have experienced, okay, the saline which is there generally used when the patient need some IVs. Okay, at that time this terminology used DNS. Yeah, patient la DNS down there likewise. So what it is there, it is dextrose if it is 5. Okay, D5NS, dextrose 5% normal saline. Similarly, D5.5, that is 5 half DNS. Then dextrose in water. Okay, not normal saline, DWD5W. Another abbreviations, EC is enteric coated. Okay, generally in tablets you will be having this observation. Elixirs, another popular terminology which is there. Okay, then as directed, EMP. Then F, another popular terminology, Fahrenheit. Fluid, FL or FLD. Then FT is make. Another used, another popular one, G, small g or capital G, small m. Okay, for gram, and if you are writing it gr, it means grain. Okay, then for drops, see here no use of d, but the meaning for drops, the abbreviation used for drop is g double t small, and drops g double t s. This is also popular over the counter OTC. Then for eyes, okay, each ear, a o u, and sorry, each eye, and for ear we have seen au. Okay, here for eyes ou. Then ons, this is also known to us. Then p or per, it is by. Per, we know we use per o. See here by mouth, it is there, no? PM, afternoon, which is there, or evening. Then PC, okay, after meals. PCN for penicillin. Post, generally used for after. Another abbreviations, many are there, we should go all of them. HTCZ, sorry, HCTZ, hydrochlorothiazide, a drug which is there. Okay, then at bedtime, H dot S dot, ideal body weight, IBW. ID, intradermal, this is a popular one, intradermal, intramuscular. ING for injection. IU for international units. Intrauterine device, this is also popular one. Okay, and IV, again most popular one, intravenous. Then PR, rectal. Pre-op means pre-operative, this is before surgery. PRN, see this is what we have studied in earlier, in capital we have written PRN, as needed. Then pulp, that is for powder. Q for every, okay, quarter. QD means every day. QID means 4 times a day, quarter in die, which is called as, okay, 4 times a day. QOD, every other day. And QS, this is also used popularly, quantity sufficient, okay, or sufficient quantity. Next, intravenous push, IVP. Then intravenous piggyback, IVPB. JT or J tube, that is jejunostomy tube. KVO, keep wine open. Then L for liter, which we use. LE means lower extremities. LR, lactated ringer injection, okay, that might be used by you. Then QSAD, that is sufficient quantity to make. S, or if you want to make a line over the S, okay, above the S, which is without. Okay, and if it is C, we know with, and here is without or plain S. SC, small, or SQ. SUBQ, sub Q, or SUBCUT, subcut. All are having the abbreviations for subcutaneous. SIG for right on label. SL for sublingual. Okay, solution, this is we are using SOL dot, then SS 1/2. Then another popularly used HR, or circle, that is sort of degree symbol, and is hour. Okay, M2, small or capital, square meter. MCG, or micro, that is microgram, we know. Meter dose inhaler, MDI, okay, generally the pump. actuator which are there. They are meter dose inhalers which are called as for asthmatic patients, which are used generally. Okay, then milli equivalent MEQ, mg milligram known, minute milliliter. Okay, then milk of magnesia is also used, ppm parts per million, which is known. This is a different one, STAT stat, immediately. Suppository, suspension, syrup is also used, tablet, TAB, DOS, such doses. Then tablespoon is also used, TBSP, and TID, that is thrice a day or 3 times a day. Further, MOSM or MOSM mole, that is millions mole. MR may repeat is the important one. Okay, because where the refilling of medication is needed at that time, this abbreviation can be written in the prescription or medication order, that is may repeat, MR in short. And may MRX, and in front sometime, okay, 1 time, twice, thrice, that may repeat 2 times, 5 times, whatever it may be. MRX, if you want to repeat twice or 2 times, it can write MRX2 likewise. Then nasogastric tube, that is NG or NGT, no number, we are using it. Okay, nocturnal or NOCT means night. Then non-REP or NR, that is do not repeat, no refill. Okay, CMR for may repeat, and NR for not to repeat or no refills should be done. Tincture, we use it 3 times a week. Okay, W. Then top for topical application, then teaspoonful. Okay, TBS for tablespoon, and TSP for teaspoon. U for units, small or capital. UD means as director, UE means upper extremities. Then NPO, nothing by mouth. This is another important one. No need to give anything by mouth. Okay, orally should not be given anything. So at that time it is mentioned NPO. Then normal saline NS, having the inclusion of 0.9% sodium chloride. Half NS, half strength of it. Okay, 0.45%. NTG, that is nitroglycerin for eye, OD right eye, OS left eye, ONT ointment. Okay, for ointment one more abbreviation is there, UNG. Then VAG for vaginal, VOL for volume, W oblique is for width again. Okay, it is having one more. Then while awake, WA. Then without, VW oblique O, and X means times. So these are maximum what we have covered, the abbreviations popularly used in the prescriptions or medication orders. Now next point is another important aspect, what are different legal requirement of this prescriptions. So that are according to the all schedules what we have studied, okay, earlier in pharmaceutical jurisprudence. The classifications are there of the medications. So depending upon the inclusion of the drugs in such schedules, there are some variation in the legal aspects of the easiness of writing or freely usable medications while prescribing by the doctors, which is needed to be studied in this section, okay, or in this point. Let us see in detail. Practicing clinician means again the doctors or the specialist, we can say, of the medicine, MDs, which are called as, okay, doctor of medicines. They are frequently visited by patients, we know, okay, which are generally going there to the such clinician to get medicines for their diseases, okay, chief illness which are there, okay. So whatever legal requirements are there, those are depending upon the classification of the medicines according to the schedule. So there are 5 different levels of scheduling of all medications, okay, from one schedule 1, schedule 2, schedule 3, schedule 4, and schedule 5. When we say the first one, schedule 1, which is having the most toughest control or rigidest control needed when the drugs which are mentioned or under the list of schedule 1 category, okay, they should be prescribed only in limited time, okay, when they are extremely needed, hence they are called as schedule 1, okay. And schedule 5, if we say at the last, these are less restrictive, there are very less control over the mentioning of or using such medication in the prescription or medication orders is there, okay. Let us see in detail. There need to be an understanding by the physician of the mechanism and properties of medication before prescribing. Definitely it is there and they are aware of this thing, okay. All the doctors who are practicing or having the uh, experience, definitely, okay, during their degrees or during their so called as practice, they acquire the experience of the medication, they understand the detailed mechanism how it works, they also uh, get the information of the different properties of the medication, what they are going to write in the prescription, okay. That is the important thing, because without that they are not, they should not use them in the prescription, or they should not mention them in the prescription. Further, pharmacist must be aware of the potential interaction. Definitely the pharmacist who is having actually the more knowledge of the medication should be aware, okay, they should be having the knowledge what the interactions may occur in the patient which they are administering, okay. It can be drug interaction, drug food interaction, or whatever it may be, those uh, harms which can be observed, okay, during the administration of such medication should be known to the pharmacist. Particularly the control substances are said to be the one who are having the highest possibilities of misuse, okay, and along with the potential harming ability they are having, means the harm or the problem which can be occurring into the patient, which are definitely at the higher level, okay, which are called as controlled substances, okay, or habit forming substances, we are aware with these things. Thus all such controlled substances are said to uh, have some stringent guidelines or strict regulations, as well as they should have specific requirements while writing them in the prescription at both level, national as well as the state level, okay. And if they are followed by the doctors, okay, then only they are allowed, and also only the licensed doctor or the registered physicians, okay, are allowed to use or to write such medication which are called as controlled substances in the prescriptions. Okay, the time is over. Next point about this legal requirement we'll be discussing in our coming lecture. Thank you. Take care. Bye.